Hello, I'm Nick Chapman. I'm the Chief Executive of NHS Direct. Welcome to this short video. We hope it'll be helpful in explaining what's happening with the new NHS 111 service and NHS Direct's role in that. NHS 111 is the new memorable three-digit number that's being designed to enable patients to access local health services working in an integrated way to provide patients with a response in the event that they need urgent or emergency care advice, but short of life-threatening 999 emergencies, and also to provide patients with self-care advice for them and their families.
Well, what we're hoping, of course, is that by phoning 111 and finding out where you should go as a patient, you'll be less likely to pitch up at A&E, and you'll be less likely to phone 999 unless that's the right place for you to go. Hopefully we'll see a reduction in inappropriate and unnecessary attendances at A&E and a reduction in the kind of 999 call that doesn't require a blue light flashing ambulance.
We've got trained both health advisors but also nurses who are ensuring that the advice that is given to patients is clinically sound and validated.
The NHS 111 service is really good to work for. It's exciting, being able to help local people. We've got input, so if we think that we can improve the service.
NHS 111 is good for patients. It gets them to a care point quicker, it gets them to the correct outcome, and ultimately gets the patient seen by someone a lot quicker. They're using the 111 service primarily for medical advice, whether that be coughs, cold, flu, all the way through medicines advice, burn advice, and as serious as chest pain and things like that.
I think the NHS pathway system is really good. We've got the body map, which it helps when people phone up with the symptoms. You can pick on the body map where it would be.
I think it'll be good for patients because it'll give them good, high quality advice. If they need to access healthcare urgently, then they would be speedily enabled to do that. If they need self-care advice and don't need to access hospital or primary care services, then 111 will give them good self-care advice.
We've had almost universal acclaim for the service by patients. I think most patients believe it's a brilliant idea to have a 111 number, and the comments I've had are, why haven't we thought of this before?
It'll be a more joined up and integrated response and seen by patients as being their local service. NHS Direct wants to be a really high quality provider of 111 services to local health communities. What that means is working with ambulance trusts, GP out of hours providers, acute trusts and commissioners to provide their patients with good access to the right services quickly, but also to provide patients with self-care advice.
Our initial model was involving NHS Direct, the ambulance service and our out-of-hours services. As time progressed, it became more evident that as we move towards our final model, NHS Direct will be most suited to do the call handling and health information services which they have the expertise in.
There's a national minimum specification for the 111 service, so we have to provide the same basic services across the whole of the country. So these will include things like being able to automatically dispatch an ambulance, being able to warm transfer phone calls across to nurses from health advisors if they need to speak to clinicians, being able to send data across to the out-of-hours providers and booking appointments where it's appropriate to do so. So we continue to do all of that across the country.
We've worked with local health organisations, ambulance trusts, GP out-of-hours providers, commissioners and acute trusts in 4 parts of the country. We've got over 150 of our staff who are already up and running and trained to provide the 111 service in these pilots. And what we're doing is learning how we can best provide the service working alongside others.
The key thing about making a thing work is partnership working. So for example, you've got somebody answering the calls, you've got an ambulance service and in the ambulances, you've got GPs in the wider community during the day, you've got an out-of-hours service who sees patients during the evening, and all of those stakeholders have to be working off of the same page. Well, we think we're best placed to provide these services because basically it's what we've been doing for the last 11 years. We are the only provider that is involved in every single 111 pilot that's live so far. We've got national scale, we've got national coverage, we've got experienced health advisors.
As I've been at NHS Direct for a long time, 7 years now, you can pick up things what people are saying, you know, it may be in the background or you can hear in their voice the change when they're concerned. And we do have a lot of training as well, like vulnerable adults, child protection, which also comes in handy because we know what we're looking out for.
The experience from NHS Direct relates quite easily to the 111 service. It's exactly the same, it's just a different computer system.
NHS Direct's been delivering this kind of service for 11 years, so I think we're perfectly placed to deliver a really good quality of service to the public, as we are doing now.
The biggest things we've learnt so far is actually that the teamwork and the working together across the organisations is absolutely key.
Well, we've learnt a lot through this pilot. I mean, when you take on a pilot, you do expect to learn and change the service. But one of the key things, I think, is we are delivering patient benefits as we hope to. So patients are picking up a phone, dialing 111, and at the end of that call, they know what they should do next. And that's been a great benefit to the patient.
I think that it's early days to be absolutely clear about everything, all the benefits that 111 can bring. But to date, I think we're proving that it can be a success for local health communities.